Good morning, good afternoon, and good evening, wherever you are, to those who've joined to this EGPAF CIPHER webinar on connecting research and practice. My name is Laura Gay. I'm the Vice President for Research at the Elizabeth Glaser Pediatric AIDS Foundation and have worked closely with the CIPHER program on this important educational and research initiative of CIPHER. I'd like to first go through a couple of housekeeping rules so that everyone is aware how we're managing this webinar. This webinar is being recorded both here in the main room and as you've seen when we move into the thematic rooms. These recordings will be shared with participants after the event. So that you're aware, all participants are currently muted for this section until you go into the thematic rooms. We have an ongoing chat box which will be monitored, so please send any questions through the chat box in order to manage the large number of people on this webinar. There will be important messages sent throughout to the chat box, so please also take a moment to read them, including when we get to the thematic room assignments. I'd like to just talk a little bit about the agenda of this important webinar. So first, as you see, I will do some opening remarks. We'll then hear about the CIPHER grant program overview from Marissa Vicari at IAS, and then everyone will relocate to the thematic rooms. As you've seen in the invitation, there are 3 thematic rooms. Those links to the rooms will be posted in the chat box. So once we go through this general overview, you'll be instructed where to go to on the chat. You can connect to that link and that will put you into that specific room where you can attend the specific presentations from the CIPHER awardees. To go through a little bit about this webinar, this is really an important collaboration in terms of CIPHER and the Elizabeth Glaser Pediatric AIDS Foundation, really with the goal of accelerating the translation of research activities into practice, into policies. It's a unique opportunity to bring together researchers, program managers, and policymakers in order to collaborate and discuss the process, the implementation, and the translation of these important topics. Through the grant program, the CIPHER, the Collaborative Initiative for Pediatric HIV Education and Research, provides seed money to early stage investigators to really address a series of critical gaps that have been identified in HIV research in pediatrics and adolescents. This is really designed to support early stage investigators, particularly in resource limited settings, to build capacity, to have mentorship, to get feedback, to launch their independent careers, and really focus on the next generation of researchers who can take on the mantle of solving the final problems that we have to address. This webinar is really important. The goal is to really facilitate interaction for the field to be introduced to the grantees, for the grantees to discuss their work, whether at the early stage or results, get feedback, learn from the experts in the room, both on the program side, the policy side, and research side. It's really a unique opportunity for engagement, and we hope that there will be, once you get to the thematic rooms, that this will be a vigorous discussion and engagement. I'm very pleased to welcome everyone to this webinar from all sides, from implementers, policymakers, and stakeholders. We really would like to optimize the engagement. The purpose of research in this program and the awards is not just for research sake, but to ensure that the research results are relevant and will inform the field and make changes. So with that introduction, I'm going to introduce you to the first speaker, Marissa Vicari, CIPHER's manager at IAS, who will provide you a more detailed overview of the CIPHER program. Go ahead, Marissa.
Thank you so much, Laura. And I'm very pleased to be here today with EGPAF. This has been such a close collaboration with EGPAF from the very beginning, with Laura's support in helping us to launch and develop CIPHER as part of our scientific and technical advisory committee. So it's wonderful to come to this day where we have years later these brilliant grantees and are able to share this ongoing work with this group to get input and have an interaction here so that we can ensure that their work is translated to action. So I'm going to, next slide, please. I'm going to tell you a little bit about CIPHER and go into detail a bit more about the research grant program. Next slide, please. So the CIPHER strategy really has an overlying mission of accelerating the evidence-informed response for infants, children, adolescents, and youth living with and infected by HIV. And we do this through a kind of a knowledge-producing, translating evidence to action approach, where we are increasingly engaging the researchers with the end users of the knowledge, policymakers and programmers. And this is stemming from part of our strategy review, where we identified that now in what's really needed in pediatric and adolescent HIV is very much better to understand the how. And we've heard a call from implementers that it is really important that they are more and more involved in all of the research process. Next slide, please. So the CIPHER grant program, Laura gave a really nice overview of what it's for, but how does it work? This is aimed at early stage investigators. So when you have your terminal, what we call the terminal degree, the MD, the PhD or equivalent, and then under 10 years of experience beyond that point. It's a stepping up grant, so to speak, for investigators so that they can be, for the first time, the PI on a significant moderate size grant. There is a very strong mentorship component, and we have a fantastic family of mentors that have come forward with the grantees, and mentors and grantees apply together as pairs. And the projects must address one of the identified priority research questions that we have developed in the CIPHER and WHO global research agendas on pediatric and adolescent HIV. And I don't have a specific slide for those, but those are online. The grants are for up to 150,000 USD for over 2 years. They address questions in LMICs, and 80% of direct costs go to LMICs, and 80% of our awardees are from LMICs. Next slide, please. So the timeline for this is that we launch the call at the International AIDS Conference or the IS Conference on HIV Science. The LOI submission is open for the month of October, and applicants are invited to submit a full proposal in December. That's a short list. That's about 25% of overall applicants. Successful applicants are notified in May, again, another 20% of that list, and they're awarded at the conference in the plenary. But it doesn't stop there. We really have a CIPHER grantee and fellow for our fellows community that continues through the course of their research, and even afterwards. We bring them to the international AIDS conferences and IS conferences for the duration of their grant. We have a wonderful collaboration with the International Workshop on HIV Pediatrics, which provides registration for the duration of their grant. And we are increasingly having evidence to action events at a global and regional level, where we have the grantees gathered together to share their information on thematic areas or regional topics. We also have their profiles on the IS website and put them forward in other IAS platforms as well, and partner platforms. For example, this one, the EGPAF Evidence to Action platform. Next slide, please. So what have we been able to do up until now? So thus far, we have 40 grantees proudly in 15 countries. We've been able to award 5.6 million USD through this program since it launched in 2013. Next slide, please. And the results have been, I have to say, really delightful and impressive. The grantees have had a tremendous impact on influencing policy and practice, with 16 policy documents and guidelines informed. In terms of dissemination of research, there's been 138 papers collectively published by the grantees in peer-reviewed journals, 205 presentations in scientific meetings, and the grantees as a pool have leveraged over 21 million in additional funding for their continued research. And all of the grantees have experienced significant professional development. Next slide, please. So each year we're choosing a new thematic focus. For example, this year the focus is on service delivery for HIV and related co-infections, including COVID, with also a focus on community interventions to improve outcomes along the HIV cascade. And I have to say that last year we opened a Francophone track for the grant program, and you can now apply in French. And we're very, very proud of our Francophone applicants as well. And we'll continue this possibility to apply in French. Next slide, please. And I must take this time to acknowledge all of the people. This has truly been a collaborative effort. As I mentioned, beginning with our CIPHER stack, we have a very dedicated research grant working group, and now a Francophone advisory group. And I want to give a special shout out to the team at CIPHER, particularly Daphne Blanc, who really led in this particular webinar and shaping this, and is the project manager for the grant program, as well as Julia Mesapio, who's helped us very much on this webinar, and especially to the team at EGPAF for this collaboration, and Sarah Dennison, who's helping us, and of course, Laura. And thank you very much for the collaboration on this webinar. Next slide, please. And of course, thank you to our sponsors. CIPHER is largely funded through ViV Healthcare with sponsorship from Janssen as well. Next slide. So now, time to get down to it. The thematic rooms. So as Laura mentioned, we're going to break out each into 3 thematic rooms across testing, treatment, and service delivery. So here is the room for adolescent testing, pediatric and adolescent testing. It's going to be facilitated by our grantee Irene Nguna. And here we have 4 fantastic projects that you'll be able to speak with the grantees. And please do interact, ask questions, network, and even follow up afterwards for all of these different breakout groups. So here, if you want to go and see about these grantees, you have Arnold Sadio with access to self-testing and prevalence of HIV and associated factors in vulnerable population, the adolescents in the streets of Togo. We have Alan Amstutz looking at secondary distribution of oral self-tests in Lesotho. Sarah Skeen looking at an evidence-based intervention to promote HIV testing of young children in community-based parenting programs. And Tasmin Phillips, you're looking at routine electronic mother-infant data to support retention and postpartum HIV treatment and early infant diagnosis in South Africa. Next slide, please. In room 2, we have pediatric and adolescent treatment, and this is going to be facilitated by our grantee, Birkne Tedes. So here we have Carrie Evans looking at the impact of improved water sanitation and hygiene on cytomegalovirus co-infection in HIV-affected mothers and children in rural Zimbabwe. Desiree Dahuru looking at evaluation of mental health resistance mutations and practices of new therapies, new therapeutic regimen introduction and tolerance in adolescents living with HIV in West Africa. Jen and Dietrich looking at the role of psychosocial resources with HIV knowledge and ART exposure in adolescent girls and young women living with HIV in South Africa. And Tongji and Jasper looking at the impact of structured caregiver peer support on ART adherence and viral suppression in children living with HIV in Nigeria. Next slide, please. So finally, in room 3, we're looking at service delivery with Alona Tosca and improving retention of PMTCT and ART in adolescent mothers living with HIV and their children in South Africa. Sirinia Tirananchi looking at the evaluation of service delivery to improve HIV treatment cascade among HIV-infected youth in Thailand. And Miriam Brooks looking at implementing lay counselor-based mental health services to meet the complex needs of youth living with and vulnerable to HIV in Botswana. So next slide, please. And here I think I hand back over to Laura to explain about the links in the chat box and the thematic rooms. Laura, over to you. Thank you.
Thanks very much. Sorry, Marissa. All the participants can see if you open the chat box, there is a description of each of the thematic rooms, which is also shown on the slide right now. These are new Zoom links, so if you click on that link, it will put you into that specific thematic room where the facilitators will be available and ready to start those sessions. So we'll give you a few minutes to go ahead and click on those links and enter those the rooms, and this one we'll leave the main room and go to these specific Zoom rooms.